Fevers in babies and toddlers can be scary for parents, but how high is too high? And is a drive to the emergency room always necessary? Hi, I'm Dr. Lena Vanderlist. I'm a mom of two and a pediatrician with UC Davis Children's Hospital. Today we're talking about fever in toddlers. And let me tell you, with two kids in daycare right now, this is something I consider myself an expert in. A fever means that your child's body temperature reaches 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. And a fever is one way the body helps fight off infections. But fevers are not the enemy. They're actually doing an important job. So when do we need to worry about a fever? Really, any baby under the age of 3 months, we recommend an in-person evaluation. But after your baby is 3 months old, you can usually breathe a sigh of relief because the vast majority of fevers can be managed easily at home. But when do we want a child with a fever to be seen in their doctor's office? Well, I usually think about these things. So if the fever has ever been 100.4 or higher for 5 days in a row, we always want to see your child. If the fever is high and there's really no other symptoms, this is especially true in young children that can't really tell us if they're in pain or tell us what's wrong. We want to look in their ears to make sure there's no ear infection. We may want to check the urine to make sure there's not something like a UTI. And then if the fever is causing concern for dehydration, so your kid feels so bad that they're not drinking well and they're not drinking well enough to go pee at least once every 8 hours or more, then we want to see them. Or if the fever is accompanied by something like a cough and you're worried about your child's breathing. They're breathing really fast, they're showing work of breathing, you might see the muscles retracting under their ribs or hear wheezing. For all of those reasons, we would want to see them in the doctor's office. But if they're otherwise doing well and none of those things are true, then you can manage it at home. So how do we treat a fever? Not all fevers need medication. Look at the kid in front of you. If they're playful, they're drinking well, they're alert, then it's really okay not to give them fever-reducing medicines. But if the kid in front of you is miserable, they're not drinking well, then fever-reducing medicines can be helpful. Acetaminophen or Tylenol can be used at any age. Ibuprofen or Motrin, in the US, we generally avoid until the child is 6 months or older. You can give these medicines alternating every 3 hours to keep a child comfortable. So Tylenol, 3 hours later Motrin. You want to write down which medication you gave so that you avoid giving too much of one or causing an unintentional overdose. You want to make sure you are always giving the appropriate dose based on your child's weight. And remember, always avoid using aspirin in children with fever. Aside from fever-reducing medications, you want to make sure that your child is getting plenty of fluids. So frequent breastfeeding or formula for young children, water or oral rehydration drinks for older kids are great. And I love popsicles when you're sick because that's a great, easy way to get fluids in. You want to dress them in light clothing, apply a cool washcloth to their forehead if they're uncomfortable, but remember to avoid that old myth about ice baths. Those are not recommended. Make sure your kid gets plenty of rest and those usual screen time limits you have at home can go out the window while they're sick. Keep your child home from daycare until they are at least 24 hours fever-free and their symptoms are improving. And always make sure your child is up to date on their routine vaccinations to avoid those vaccine-preventable fevers. Check out our Kids Considered podcast for more information about fever in children. Thanks for watching and be sure to subscribe for the latest episodes of A Little Lessons with UC Davis Children's Hospital.